our first presenter will be Mr. Takashi Kendo from Tokyo, from Japan. Takashi is in charge of international cooperation at the Fire and Disaster Management Agency in Japan. He manages a variety of cross-border projects which contributes to enhancing the fire service and the disaster management system in developing countries, especially in East Asia region. He was also deployed with with Japan team on several disaster areas around the world, and was responsible there to oversaw the in-country arrangement. So he will give us a presentation on challenges for fire service in Japan during this pandemic. Now I would kindly ask Mr. Takashi to share the presentation with us and to see if everything works.
All right. Good morning and good afternoon and good evening to everyone. My name is Takashi Kendo, Fire and Disaster Management Agency in Japan. I'm joining you from the Tokyo. Very nice to meet you. And thank you very much for inviting us to the CTIF webinar today. So due to the ongoing pandemic, it's quite limited now that we can meet and exchange the information with each other. So organizing this kind of event amid the pandemic is very significant and beneficial for everyone who are involved in the fire service and the disaster response, as we can share the various things on this platform. I appreciate this opportunity. Thank you. And today I will make a brief presentation about the fire service in Japan under the ongoing pandemic. Just a second, I will set up my presentation. I hope this slide is properly on the screen so that everyone can see.
Yes, Mr. Takashi, we can see. Thank you. You can continue.
All right. So in the case of Japan, municipal governments are mainly responsible for the fire service and disaster management. The municipal governments are required to establish and run their own fire service department by law. And around 720 fire service departments are operated solely or jointly by municipalities across the nation now. And I assume that some of the audience have heard of Tokyo Fire Department, which is the largest fire service organizations over the world. And about 20,000 professional firefighters are working with Tokyo Fire Department to secure the safety of the metropolitan Tokyo, where more than 10 million people are living. And Tokyo Fire Department is also one of the... Would be okay to continue? So that I got some notes.
It's okay now. You can continue. Okay.
Okay. Thank you, Chris. And the Tokyo Fire Department is also one of the municipality-based fire service department in Japan. And the day-to-day operation of fire service, firefighting, fire safety, rescue activity, and ambulance service, these are implemented by municipal fire service departments on their own initiative in accordance with environment, geographical condition, and situation of communities in their jurisdiction. The needs in fire service and disaster management are different from community to community. When relying on the local governments rather than centralization setting, it works much better to effectively and efficiently protect the people and the public. Our agency and the Fire and Disaster Management Agency, which is called in short FDMA. FDMA is part of the national government, we do not micromanage the day-to-day operation of the fire service department. Actually, we are expected to provide them with technical advice to enhance the quality of fire service and disaster management, and also activate and manage the national mutual support system when the fire service department is overwhelmed by large-scale disasters like great earthquake, massive scale tsunami, and wide range flood. And fortunately, the COVID-19 pandemic has not overwhelmed the capacity of fire service department in our country so far. All of the fire service departments have functioned as normal as the pre-pandemic. So it has not been necessary for us to activate the national mutual support system in terms of countermeasure to the COVID-19. And so the main part of our effort regarding the pandemic is technical advice and other indirect support for municipalities, including their fire service departments. And for the past year, FDMA has issued various advisory notices and offered assistance for local governments to make sure they can fulfill their duties of day-to-day operation, even in the pandemic situation, especially in the field of ambulance service, fire safety, evacuation shelter operation, and public awareness dissemination. These are something I will talk about from now to share with you what we have focused on under the ongoing pandemic. And on the same day, when Japanese Ministry of Health announced the first case of the COVID-19 infection in Japan, that was on January 16, 2020. FDMA issued a warning of the COVID-19 to all of the fire service department, together with the standard of operation about the ambulance service for infectious disease patients. This standard of operation includes PPE wearing steps and the disinfection procedure for ambulance cars. In Japan, principally, the transportation of the infectious disease patient to the hospital is under responsibility of the regional healthcare centers with the leadership by prefectural governments rather than the ambulance service provided by fire service department. However, it is vital to secure the medical control in every community, even under the challenging situation caused by the pandemic. In addition, our agency received a request from the Ministry of Health. The ministry would like to the ambulance service to assist prefectural government for the infectious disease patient transportation. Having seen these circumstances, FDMA decided to ask all of the fire service departments to support the regional healthcare centers in transportation of people infected with the COVID-19. And actually, any fire service department has not rejected our request throughout the country. And in addition to following the standard of the operation, the mutual information sharing and the cross communication between the fire service department and the healthcare center is very important to decrease ambulance dispatch difficulty cases. So we have emphasized on this point through our advisory notes. Usually, in most cases, ambulance crews need to directly contact the hospitals to transport the patient in need for the medical treatment. But same as in many other countries, the pandemic increasingly puts the medical service under the huge pressure, and a lot of hospitals started rejecting the acceptance of patients from the ambulance units. To resolve this hard situation, the government asked the healthcare centers to function as a coordinator that keeps the checking availability of hospitals in their communities and assign the hospital to patients transported by the ambulance crews. This initiative can lead to smooth and efficient ambulance handover. And FDMA has regularly monitored the situation of the ambulance service across the nation to detect the patient transportation program ambulance crews faced. The monitoring result has been shared with Ministry of Health and other relevant organizations to make sure the stakeholders properly and commonly understand what is happening in the coordination between the ambulance service and the medical institution, and on which regions and on which municipalities the government should put priorities for stepping up the medical capabilities.
Mr. Takashi?
Yes.
It is please, just one, sorry for that. There is some background voice. Is it maybe coming from your office? Because all our others are muted. It's possible to reduce the background voice that we could hear you better, if it's possible. Thank you.
So, sorry, could you say that again? I can't catch that well.
There is some background sound in your office. If you can slow it down, if it's possible, that we can hear you clear.
Oh, really? Okay, I will change the location. Just
Now,
okay,
yeah,
just
let's continue.
Okay, just a second.
Okay.
Oh, is it better?
It's now better, please. Thank you very much.
Better. Okay. And okay, the monitoring result has been shared with the Ministry of Health and other relevant organizations, and to make sure the stakeholders properly and commonly understand what is happening in the coordination between the ambulance service and the medical institution, and on which regions or the municipalities the government should priority for the stepping up the medical capacity. Also, based on the monitoring result, FDMA has requested the stakeholders to further cooperate with each other to enhance the hospital capacity to accept the patient from the ambulance unit. These efforts have helped the ambulance service in Japan to work as much as possible, even in the pandemic. And as the COVID-19 spread worsened into the pandemic, the supply chain of infectious prevention goods like face mask, protection gown became unstable. And some fire service departments began struggling with the procurement of these prevention material. To respond to such the challenge of the PPE shortfall, FDMA requested the supply companies of the PPE to prioritize the fire service organization when they sell the infectious prevention goods. We also secured the face mask and the protection gown for some fire service departments. It is totally different from the usual protocol. In the ordinary situation, the day-to-day operation goods like the PPE are supposed to be secured by fire service department by themselves. And normally, the central government is less than involved in these PPE procurements. But considering the unprecedented impact of the COVID-19, we took an action purchasing the PPE for the fire service department. Moreover, FDMA has implemented the financial support to local government, which helped the fire service department to increase ambulance unit and secure ambulance stretcher with active control isolator system. And since the pandemic started, alcohol-based hand sanitizer have become essential for our daily lives to save. The demand for hand sanitizer disinfectant was significantly so strong as to overwhelm the supply, especially at the initial phase of the pandemic. To respond to the increasing demand for the hand sanitizer, it is necessary for the production and the supply condition of alcohol to be robust and stable more than before, which means that fire service authorities may need to consider making the hazard material safety regulation less strict in some type of alcohol. FDMA has requested all of the fire service department to take the demand for alcohol into consideration when regulating the dangerous goods in their jurisdiction. The balance between the hazmat safety and the pandemic countermeasure is so vital. And given that FDMA issued to fire service department some safety advisory notes that help the fire service department flexibly regulate the alcohol in accordance with the pandemic situation, which makes it possible to build a balance between the appropriate fire safety arrangement and the stable alcohol supply setting. Obviously, the hazard material regulation is quite important for the public safety. It should be strictly regulated by fire service authorities. And the exceptional treatment I mentioned here is limitedly applied to the extraordinary situation. This temporary measure should be available only when the alcohol is in shortage under the pandemic. Since the supply and the demand of alcohol returned to stable and normal, the regulation has been implemented as it had been. Also, FDMA has created a leaflet for the public awareness of the fire safety of disinfectant alcohol. The leaflet gave some basic instruction to the public. It warns the hand sanitization has a high volume and the concentration of alcohol and the potential of fire hazards. The illustrated leaflet instructs the people about what should be avoided from fire safety aspects when handling disinfection alcohol in their daily life. And as a method of the infection control in public, the plastic sheet has popped at various places, like at the shop cashier and office reception, to prevent a droplet infection of COVID-19. The plastic sheet is largely made of flammable materials, and FDMA created a safety awareness flyer to avoid fire incidents and other life-threatening problems caused with the anti-droplet infection plastic sheet. The illustrated flyer advises people the plastic sheet should be placed distant from fire and heat and not set near the smoke detector or the sprinkler, which could hinder these fire safety equipment from functioning well. These points I mentioned here, but not familiar to everyone in public. That's why FDMA has created this awareness flyer. And as you may know, Japan is hugely prone to the natural disasters. It said 20% of magnitude over 6.0 earthquake around the world have occurred in Japan. And typhoon and the torrential shower frequently bring about destructive floods almost every summer. As a disaster response, the evacuation is quite important to protect the people's lives, and the operation of evacuation shelter is one of the key tasks for municipalities. Regardless of the pandemic happening or not, a natural disaster can occur, and the pandemic has affected the shelter operation as well. And regarding the disaster shelter operation amid the pandemic, we need to make it different from the pre-pandemic period, because a lot of people stay there for a long time for evacuation, while the space is quite limited with flat ventilation. It must be close contact setting. FDMA, together with relevant ministries, issued the general guidelines about the evacuation shelter management during the pandemic, just after having seen the COVID-19 impact become more serious than initially predicted. Following the first advisory note, FDMA has issued a series of guidelines on the evacuation shelter operation in the pandemic, which include operational considerations and illustrations that show an example of the shelter layout, so the municipal officials can have clear images in their mind about what they need to do to decrease the risk of the COVID-19 infection in the evacuation shelter. In the series of the guidance, FDMA has encouraged the local government to implement the simulation and the exercise to make sure of their preparedness for the proper shelter operation under the pandemic. Through the continuous exercise, they can clarify their specific consideration points, such as how to receive evacuees without 3 Cs. 3 Cs means crowded place, close contact setting, and confined and enclosed spaces. There is something we need to prevent all the time in terms of the COVID-19 prevention, continuous and simulation and exercise. Also, FDMA emphasizes on the importance of the engagement of the both government and the non-governmental organizations into exercise, which can lead to the successful planning of the evacuation shelter amid the pandemic. The advice note touches on a key point. The exercise should be undertaken not only by disaster management section, but also healthcare sections. The collaboration, cross communication of these sections is quite vital for the management of the evacuation shelter, especially under the pandemic. Through repeating the exercise in various situations, a lot of things can be clarified. For instance, how many staff needed for each part in the evacuation shelter, and if the staff assignment is functional or not. To facilitate the shelter management exercise across the nation, we created a checklist so the local government officials can make sure to realize what is essential to operate the evacuation shelter under the pandemic. As I explained so far, FDMA is issuing a series of pandemic-related guidance and advisory notes to local government about evacuation shelter operation. But these ones don't necessarily cover all of the things that local government officials want to know. FDMA created two Q&A documents, which contained the questions from local government and central government officials' answers regarding the evacuation shelter operation. And these documents have been shared with all of the local governments for the successful evacuation management every fair. As a means of disaster preparedness, FDMA has facilitated the disaster warning system and promoted the transmission channel to be diversified in order to ensure the disaster warning and the information arrive at all of the people without fail, no matter which nature of disaster or man-made disaster. We have found these information sharing system, especially the indoor speaker, useful to disseminate the public awareness about the pandemic from the local government to residents, because the indoor speaker can make the public message reach residents more clearly than other channel. So we have made some financial support for local government to supply the indoor speaker, which was not so expensive and doesn't need so much time to be installed to household. The indoor speakers supplied by FDMA and local government amounted to around 240,000 across the nation. In addition to four fields I explained here, FDMA has made some advisory documents about the COVID-19 prevention measures for both professional firefighters and volunteer firefighters, and who are supposed to attend a fire incident and disaster front line, even in the pandemic. Especially for the volunteer firefighters, FDMA set up the website exclusively on the COVID-19 infection control measures and good practice for volunteer firefighters' activity under the pandemic, because we have valued the volunteer firefighters' role and achievement as a main actor who responded to the various types of disasters. Obviously, the fire service and disaster management are something essential for human life. Even though the pandemic is still looming around, we need to keep fire service department operating to protect the people from fire incidents and disasters. So we'll make every effort to support fire service department as we have done so far. Okay, so much for my presentation on the fire service in Japan and the ongoing pandemic. I hope it has addressed your interests. And thank you very much for listening, and stay safe, everyone. Thank you.
Thank you, Mr. Takashi. We checked the chat box. There is no questions till now. Maybe if you appear later on, we can contact you. Maybe one short question. During this last year, was any time that maybe, for example, fire service in Tokyo get in danger with too many people be positive firefighters, that you had a risk on assuring that 24/7 duty, or this number was not so big?
And actually, so I found the no major problem of the firefighters in Tokyo caused by the COVID-19. And Japanese firefighters is very mindful of the prevention measure to the infection, and not only the COVID-19, but also other types of the infection. They are really paying attention to the prevention measure all the time. So not so many on the Japanese firefighter infected with the COVID-19. So the impact is very limited, I think.
Okay, thank you very much. Good to hear that you are operational all the time and you can serve your community. Thank you again for this presentation.